Hello and welcome to Pregnancy Info. Today we are going to discuss about the myths about fallopian tubes. The fallopian tubes or uterine tubes are located on each side of the uterus. They play a key role in pregnancy as the fusion of the egg and the sperm fertilization take place in the fallopian tube. However, blockage in one or both the fallopian tubes may sometimes lead to infertility. It is estimated that 20% of the female infertility cases are because of blocked fallopian tubes. A large majority of women is surrounded by a lot of misconception about tubal infertility. Today, we are going to discuss the myths that are affecting the people. Number 1. Stress can block the tubes. This myth is a crowd favorite and probably one of the most frustrating, often perpetuated by those who have not personally dealt with infertility. You may have been subjected to the knee-jerk statement, just stop trying so hard. Wouldn't it be great if you could clear your fallopian tubes by simply relaxing? Unfortunately, you cannot. While there is some evidence to support the idea that stress can play a role in infertility, it doesn't directly cause blocked fallopian tubes, a mechanical condition. Number 2. Your only option is IVF. When a woman finds out she has a tubal obstruction, she may think or be told that her only option is removing the tubes and proceeding straight to the in vitro fertilization or IVF. Even if both fallopian tubes are blocked, a more conservative treatment is available. Number 3. Surgically closed tubes cannot be reopened. Fortunately, women who have had their tubes tied have the options to go through a procedure called a tubal ligation reversal, in which the surgeon rejoins the ends of the fallopian tubes that were previously blocked or clamped. Number 4. An HSG will open your tubes. While some women have reported that their tube opened following on HSG, the procedure is not intended as a treatment for blocked tubes other than anecdotal evidence. There is currently no data showing that an HSG can open blocked tubes. Number 5. You need 2 tubes to become pregnant. Some women are born with only 1 tube, while others have only 1 working tube. While having only 1 fallopian tube can decrease the chance of pregnancy, it is still possible to conceive with only that tube. If you have both ovaries, have no ovulation problem, and your remaining tube is healthy, you may be able to become pregnant. Number 6. Tubes can only be unblocked with surgery. If adhesions are causing a blockage or narrowing of the fallopian tubes, you may think the only option is to have the adhesions surgically removed. A study in the journal Human Reproduction reported that only 19% of the blocked fallopian tubes remain open 6 months after a minimally invasive surgery to clear the tubes. This means there is only a short window of time for a woman to conceive before adhesions reform. Number 7. You will never get pregnant naturally. Published research shows that women with blocked fallopian tubes were able to conceive naturally after a treatment. Therapy program helps clear blocked tubes by addressing adhesions and scarring, enabling women to have successful pregnancies without numerous drug cycles or invasive surgical procedures. Fallopian tubes play no role in pregnancy. Fallopian tubes not only provides a ground for fertilization to happen between a healthy sperm and an egg, but it also supplies nutrients to keep the gametes, means sperms and eggs, alive until they finally fuse to produce a zygote. The fallopian tube is lined by a mucosal membrane containing lactic acid, glucose, calcium, and sodium that act as nutrients for the released egg and sperm. Another myth, even 1 fallopian tube means that you cannot get pregnant. Each month, either of the 2 ovaries releases a mature egg for fertilization. This is the reason why you can still get pregnant, even there is a blockage in either of the 2 fallopian tubes. However, the chances of pregnancy to get lowered to some extent. Fallopian tubes can only get blocked because of surgical tying or clipping. There are a number of reasons because of which the fallopian tubes may get blocked. Some of the reasons include congenital tubal blockage, adhesion of tube damage, surface indentation, surgical clipping, advanced endometriosis, accidental damage during the surgery, genital tuberculosis, inflammation of the fallopian tubes due to infection. Another myth is IVF or test tube baby cannot help me if my tubes are blocked. In vitro fertilization is another reliable alternative treatment option that such women can undergo. The advantage with IVF is that the procedure totally bypasses the fallopian tubes, so whether they are blocked or opened but not functioning well, it has no effect on the pregnancy and success rate. So these are the facts about fallopian tubes, but we will discuss some reasons that are the actual reasons of blockage. Tubes can get blocked for a variety of reasons, including pelvic inflammatory disease is an infection that can affect your warm fallopian tubes or ovaries and which is left untreated can be serious. Sexually transmitted infections like gonorrhea and chlamydia. Endometriosis is an often painful condition where tissue that's similar to the lining of the uterus grows outside the uterus in your ovaries, fallopian tube or abdominal cavity. Previous abdominal surgery, hydrosalpinx, and fluid buildup and dilation of the end of the tubes. So these are the actual reasons that can block the tubes, and myths I hope I have cleared. Share this information with the couples who are trying to conceive and are not getting successful, and must share your opinion that how do you find this video, and also subscribe my channel. Thank you, take care, and bye bye.